So I'm what's called a locum GP. So I'm not permanently employed, but for the last 11 years I've been coming on a regular, irregular basis. I come about 4 stints a year and it adds up to about 16 weeks. I love it. I feel incredibly lucky to work in the Kimberley. I feel incredibly lucky to work in a predominantly Indigenous community. I feel like I've learnt endless amounts of valuable things about our country, and I feel honoured to work with this community. There's fantastic people, it's absolutely glorious land. I'm in love with the Kimberley and I try and make the most of being in this environment. It's a really good town, it's really good people, and it's a good community it's one of the best places I've been for people coming together. Well, there is now a fantastic system with emergency help. There's this thing called ETS, which has really changed how we can practice here as a GP, because in under 30 seconds we can basically have an emergency physician in the room with us. They can see the patient, see us, they can see the monitors, and we can second by second discuss it with them. And that's really revolutionised treating very sick people. The other thing is that service understands what our facilities are here and what our limitations are. And that service is instantaneous, they're really fantastic, and they're very understanding. The other way that we get help is on the phone we have excellent physicians in the Kimberley. We have obstetricians and surgeons, and they are also willing to answer questions, and there's a reasonable referral basis. So the telephone is an incredibly important tool, and the specialists who work in the Kimberley know our context. And then there's the more distant people, like the hospitals in Perth, who are also always really helpful. But it's the Kimberley team who, they understand the complexity of the medicine and the environment. I'd been a city GP forever before I started working remote. And I came to remote areas where I knew I wouldn't be the solo GP and I would be supported. And I think if you're going to come, you can upskill on the emergency requirements. The ETS makes a huge difference to that. We have really good backup, and if you've been a GP in the city, you will know lots of what you need to do, and there's good support to do the rest. And the other thing is, I think it would be a fantastic place for young doctors early in their career. I don't do city general practice anymore. When I go home, I want to come back. I love it, and I love the medical challenge and the challenge to do a thorough job. But I learn all this stuff. It's not very many places where I can have this sort of contact with First Nations people, and people are very generous with sharing their story and the history of our country, which we all need to learn. People rarely come with one condition. You need to think about heart disease, respiratory disease, mental health, social stuff, renal disease, infection. You need to pay attention to the full picture. And that's a good thing to be asked to do. I'm completely converted to the Kimberley.